Dear viewers, the World Mental Health Day that is celebrated every year on the 10th of October is aimed at raising awareness and spreading education about mental health issues across the globe. And since we are focusing on raising awareness during this evening's episode, we have been joined by Dr. Abdullah Habib, Doctor of Psychiatry and Director of Clinical Neuropsychology. Good evening, Dr. Abdullah.
Hello, how are you?
Great, thank you. And how are you doing this evening?
Pretty good, thank you.
It's a pleasure having you with us, especially that on the 10th of October, it was the International Mental Health Day. And I think a lot of people are talking about it this year.
Yeah.
Especially.
Yeah, so this year's, so every year on the 10th of October, the World Health Organization and the World Federation of Mental Health celebrate World Mental Health Day. And each year they choose a theme, and the theme is based on how they want to raise awareness for that year. And this year's theme is mental health in an unequal world, how there's so many discriminations, stigma, differentiations between who can access mental health.
Yes.
And this is what this year is about, especially with when we saw what happened with mental health and COVID during this time, is that a lot of people were not able to access mental health facilities during this period. And this is what they wanted to shine this time on, is that we're in a pandemic where already our health is at risk. Yes. And there is no, as their slogan is, there is no health without mental health. Your mental health has to be also in a very sustainable place.
Yes.
Because a lot of people that had COVID or got COVID, they also had suffered some psychological conditions due to undergoing that condition.
Exactly, and I think it's such a great theme this year because a lot of people never had the time to even sit and think about their mental health and just took it for granted, and it was, we could say, compromised at a lot of the time. So I think COVID-19, you know, with staying at home and lockdowns and not being able to leave the house, a lot of people started realizing, I do deal with anxiety, I might have depression or sleeping issues. So what is your opinion on coming back from that? So the people that during COVID-19, we can say, you know, found out they have anxiety, how do they deal with this now? Should they start seeing someone?
Well, I think it depends. Like, as you said, people, when everything started calming down from work and all the busyness of everyday life, and they sat at home and they start realizing how much anxieties they have, or how much a lack of concentration or irritability they tend to have, especially interacting with other people, that now you're in a confined space. This started raising awareness that possibly we could be having something that we weren't looking at. So the question is always, when we ask, when do I go seek help? It's always when it comes down to these three things. How long has this been going on for? And is it there for most of the day, or is it just there for a couple of minutes or an hour? And how is it impairing your everyday functioning? Does it impair your relationships? Does it impair your work or your education or your performance in any way? Now, if it's impairing your everyday functioning, and if it's also there for at least, let's say, 2 weeks consecutively, and also at the same time it's there for most of the days, then this is a red flag, and you should start considering if possibly I should be going to seek help.
For sure, as you said, if it's there for most of the time or 2 weeks in a row, there's definitely an issue. And I think people are finally realizing it's okay to go out and see a doctor, and it's really important. So what are some of the most common mental health issues that we do deal with here in Kuwait, and even just in the Gulf in general?
So I think also a little bit worldwide, and again for Mental Health Day, mental health conditions are very common. The statistics a little bit differ, but it goes between 1 in every 4 to 1 in every 5 people in their lifetime will undergo having a mental health condition. And this just shows you how frequent it is. And these, normally when we talk about the 1 in 4 to 1 in 5, normally we're referring to generalized anxiety disorder and major depressive disorder. In layman's term, they're anxiety and depression. So this is worldwide, so of course this applies to this region as well. But when we look a little bit, when we narrow down the scope to see in the Gulf region and in Kuwait, the most common ones you would see, and of course this is not backed up by any scientific research because research is limited in this region. But based on clinical practice, what we tend to see a lot after seeing a lot of patients for some years is we have a lot of bipolar disorder, we have a lot of borderline personality disorder, and we have a lot of OCD and social anxiety. These are the very most common ones that we see on a very regular basis. And there, of course, there's a reason for that. Is the one reason is that a lot of the conditions are genetically hereditary between, that plays a huge factor. But when we look about the two last ones, OCD and social anxiety, OCD, the reason it's a very unique phenomenon, and a lot of people around the world study the Arab world for that, is because part of OCD is doing repetitive things.
That's true.
And part of our culture and religion is prayer and wudu. So you do these repetitive things and people think it's normal that you wash your hands 5 times for prayer and you repeat your prayers 5 times.
A day,
and if you make a mistake, you have to repeat it. So they don't see it when it masquerades and it hides itself in the obsessive compulsions or thoughts of OCD. And that's a very common thing that you don't find in the Western world, that OCD and religious fuse, because
it's completely different there.
It's completely different.
They're not connected, yes.
And the social anxiety, I think that's also another part. We're very social in the Arab world. And a lot of times children are forced into social situations and they don't know how to deal with that, and therefore they develop this anxiety. And then later on in their life, they also have a lot of social anxiety when they have to deal with it themselves without any kind of guidance. And that's also something you don't see very often there because of the culture.
You don't need to go out and go to the family gathering if you don't want to in the West, and that's something we're used to, getting ready every weekend.
And you have to perform.
Having to see the family, you know, we're used to the same questions, so I completely understand where you're coming from. And I also have seen in the past 2 years, since COVID has been with us, that social anxiety has really become a thing. From us being very social human beings, in Kuwait, to not leaving our house for, I think it was 6 months where we weren't socializing. So now a lot of people are even having a hard time to go back to work and go to the gym and be in those social settings.
It's a very common thing. You'll realize people that used to think they don't have social anxiety, now they start to realize that I'm a little bit anxious when I interact with people. I'm a little bit anxious that I have to take off my mask. How will people interact? I've been wearing my mask this whole time, and how would we talk to each other?
Exactly.
So it's becoming more apparent to people that maybe I had something before, but it wasn't so focused on. But the situation we were in pushed it a little bit over the edge for it to become more of a problem.
Just the mask on its own, knowing that we can leave our house, hide half of our face, was so comforting, and I think it's really hard to even get out of that. A lot of us are electing to keep wearing the mask just to have this little bit of privacy, which is contributing to the issue, I think. So a lot of us do go to therapists, and a lot of people are actually scared of medication, although that it could be very helpful in many cases. So do you think that we always have to treat mental health with medication, or are just seeing a psychiatrist enough, just going for therapy sessions?
So the component of medication versus therapy is a debate that has been going on for years, and research has been showing both sides winning. But to be honest, what's the most consensus have been met by the scientific committee around the world, by the scientists, what they have seemed to be agreeing on, is that previously we used to think that we can deal with some conditions with just pure therapy. And that's true if the condition is mild. If the condition is mild, and if the condition is situational. For example, let's say somebody's having grief due to a loss of a beloved person. Therapy would help in that. We don't need to automatically lead to taking medications. But if we're talking about psychiatric conditions and people are having biological, because we have to know that mental conditions are medical conditions. They're not environmental factors that are, so they're actually medical conditions that are biological in nature. These have to be medicated, and research has shown that the combination of medication and therapy simultaneously outweighs medication alone and outweighs therapy alone. So that is normally what has been shown as the golden standard, combining both at the same time for the right patient. And of course the patient has to want and need that, because if I force any patient or any person into any kind of treatment and they're not compliant, it won't work.
It won't work, for sure.
So you need to have them on board, they agree, they understand what they're going with, and that by itself will automatically push their improvement a little bit. So do we always have to add meds? No, but for the most part, we have seen that it makes it a little bit more effective than having therapy alone, or having just medication without therapy. So they go hand in hand, to be honest.
Exactly. I think every case is different, and it's always important to see what the doctor really recommends for every case, of course. So, doctor, are mental health conditions chronic, or is it something that could go away or comes for a short period of our lives? So,
mental health conditions, by definition, they're chronic conditions. They're lifelong conditions. There is no cure for them. We can't. So even we don't use that word as a cure. You don't cure them. What we do is we treat the symptoms. We minimize them to a point where the person can live with the symptoms to a point that it's no longer an issue. But can we actually cure it fully and remove it out of the person's system? We have yet to get to that position in science.
That's true.
So all we can do is minimize the symptoms to a point that it's no longer there. So the person becomes in a position where they can live their life without any hindrance, because it doesn't exist in their life. It's minimized by therapy and it's minimized by medication. But it is there for their whole life, and it's a lifelong condition. And this brings awareness that even if somebody is healed through mental health conditions, it's also recommended that every once in a while they go and maintain therapy, like for a couple of sessions they go talk to somebody and they go check on their mental health. It's because it keeps going with you, and stressors could start triggering the condition again. So every once in a while, even though maybe somebody went through treatment and now they're recovered, it's important that, let's say, every couple of months you would go check with your doctor and see how things are going, just even to talk, just de-stress a little bit and make sure everything is going well.
As you said, doctor, for example, you mentioned anxiety in the beginning of the episode and how it's very common, more than we actually think it is. So I think with anxiety, as you said, we can manage it. We can learn to manage it. We can learn to know what our triggers are. But it could flare up at any moment. Something can come and trigger it even after 6 months or a year or two of being completely fine. So of course, checking in with your doctor every once in a while is very recommended. So when it comes to mental health in general in our, I'm not even going to say the Gulf and Kuwait, just when it comes to the Arab world, there's a stigma around it. And we have known that all our lives. And even a lot of parents are not happy with their children seeing doctors. Is this stigma still here? Is it, because I know it differs than the Western world completely. Why do we have the stigma still in 2021?
Well, there's a short answer and there's a long answer.
Of course.
The short answer, a little bit, and I'll add a little bit of the long answer. The short answer is the lack of education into this subject. We don't learn about mental health from a young age. It's not taught in schools. I remember when I was in high school and middle school, I didn't know about any of them. We didn't know about them. We never talked about them. It was a taboo subject. And we always thought about the concept of mental health or any mental condition as the term crazy.
Definitely.
That's it. Insanity.
We've seen it in our series, movies.
We don't think of it as anything else. And there's a misconception regarding that. And when you have already contaminated the image of it, it's very hard to get out of it because it has been going on for generations. So
of course.
It becomes very hard to start changing that image. So because, of course, also in the Arab world, there's certain traditions, belief, cultural aspects, religion plays a part. A lot of these things come into act together. It becomes very hard to not have a physical, a medical condition that is physical. And when it's not observed for the region here, it becomes very hard for them to believe it exists. And for them, for example, you can see if somebody has a cardiac problem.
That's right.
You can see that they have some kind of pacemaker, they have problems, they check, you can see their scans, you know if somebody has diabetes, they're always walking with their insulin. But you don't see it, it's hidden. And they think because it's hidden, it's not real.
It's not real.
And just because it's not obvious to them. And I think that's kind of the mentality why there's stigma, because they don't see it, then it must not be real, and it must be that you're making it up, and you just need to be a little bit stronger, or you need to just battle through this hardship, and one day you will beat it. But it's not that way. It's way more difficult than a lot of people understand. I tell a lot of people that don't know about mental health is by far, if you have by any unfortunate reason a mental health condition, a lot of people rank it as one of the highest levels of distress of having that as a medical condition overall.
Of course, yes.
So I think that plays a big part of why we have the stigma. And it doesn't go away because as we grow there's still people generating that same idea.
Definitely, and we have seen a lot of people wanting to seek help but having their parents say things like, it's all in your head, don't worry, sleep it off. You'll wake up better, feeling better.
Sure.
And these issues were always just brushed under the rug.
Yeah.
And as you mentioned, a lot of people don't even know the symptoms of having an anxiety attack.
Yeah.
So hopefully this awareness that's really happening recently, even on social media, could be helpful maybe for the older generations, because I think we're more aware now because we do have access to the internet.
Sure,
What is your advice to someone that really needs to see a therapist or a psychiatrist and go see a doctor, but they are not able to because of their family? What can they do in that case?
I think if we're talking about someone that's, let's say, an adult and can make the decision themselves. I think at that point is if you feel, and I remember my colleague, Dr. Mohammed Swaidan, he told me, he said a very important line. If you feel you need to go see a psychiatrist or a psychologist, you probably need to go see a psychiatrist or psychologist. So if you feel that you need to go there and you see someone, just make an appointment. Just talk to someone. There is nothing bad that would come out of it if you talk to someone.
You're not going to lose anything.
You're not, nothing you will lose. If anything, they will either confirm that everything is fine, or they will actually raise awareness that there probably could be something. So if anybody has any kind of thought of, I wanted to see someone, but they're worried, they have to know that in the field of mental health, the privacy and the confidentiality is of the highest degree worldwide. Nobody can access your files. Nobody can ask questions about you without your consent. Even if it's your parents, even if it's your friends, spouse, it doesn't make a difference. Without the adult's consent, no one can ask. It doesn't make a difference who it is. And it's only the practitioner that treats that patient gets to see their file. So even, let's say, if there's 5, 6 practitioners in a clinic, they won't get access to that file. It's not shared. So they have to know that the privacy is very high. Whatever you go and you say, it won't be leaked out, nobody would know. And so go and see what happens. And of course you have to choose, then you have to make a choice of who you go to see.
Of course. Yes, I think everyone has this issue. We live in a very small country. Everyone knows everyone. So everyone's always wondering, will my doctor know a family member, or will I run into him one day, and how confidential is it? And yes, it's highly confidential, trust me. So a doctor, there's a lot of doctors out there. For a first time or someone that's really looking to find the right doctor for their case, how do we find a good doctor in general? So there's so many psychiatrists, mental health specialists.
So I think the first line I would say is, if you already see some sort of doctor, so if it's a general practitioner, or if you're already a dentist, if you already see some sort of doctor, ask them their recommendation. Normally, colleagues within the field know each other, and they would know who they would refer to. And they would normally give you someone they would go to personally. So I personally do this. If I want to go see a dentist, I would ask my colleague, which dentist should I go see? Or if I want to go see any kind of doctor, because we know your doctor would normally refer you to someone they trust. And if you trust your doctor, then you trust them by default. Another thing is, when you go to see any kind of professional, and I would say this generally overall, but also in mental health specifically, ask about the qualifications of the person. There is no shame in asking about their degrees, what they're specialized in, where did they study, what is their experience, are they licensed, is the center licensed? Ask all these questions. You are entitled to all of these answers.
It does make a big difference.
Of course. So and there's a reason there's societies and organizations that monitor these things, because they maintain a certain standard. So for me, any person that wants to go see a mental health professional, psychologist, psychiatrist, a therapist, when you go in, I would say your first session, ask all the questions about why is this person going to be the person that takes care of your mental health. And that to me is by far going to let you know if this is a fit for you and them, and at the same time to know if this person is qualified. So ask your questions, don't be worried what can come out of that answers. And of course, ask for recommendations, word of mouth. As you said, we're a small country, and a lot of people know each other, but that's a positive thing. You get to know who's the good doctors and who's the ones that you should start not going to or avoid going to.
We definitely don't need the Google reviews, you
know.
we
don't.
You just need to ask one person. And they would have definitely at least known someone that has had an experience. So we talked a lot about this society and its connection to mental health, but how can we as a society support people with mental health issues?
I think the first thing is we need, as the whole country and a whole society, is we need to normalize mental health conditions. They're normal. Everybody has them. You will be surprised by the amount of people that have a mental health condition. So we need to normalize it and not make it seem such as a taboo, weird subject that this person has a mental condition, so it's problematic. So, and I think by normalizing it, we need to start first introducing it as a concept of education at younger age. We need to let the children know about mental health conditions, like we teach them about biology, chemistry.
Yes.
One subject about psychology is important, and we'll teach them. And they use that, to be honest, in the US and in the UK. Psychology is part of the curriculum. They teach them these things. And it lets them, while they grow up, they're aware of their mental health.
Of course.
So as a society, if we can start normalizing it, and then once we start normalizing, we can start supporting them by, for example, providing facilities that can look after them, providing different kind of facilities, not just a psychiatric hospital, but like places where they can go and have a support group to talk to each other. And this is part of the part of the Ministry of Health, so something that they don't have to go pay for, and they don't always have to end up going to private clinics and spending the money just so. So if it becomes more of a everyday life thing, and we're making it as a community, we're making it seem not a problem, then it becomes easier for us as a society to support them, and for them to feel that support back from us, and for us not to feel so bad if we end up getting a mental health condition as well ourselves. We don't feel it's such a bad thing or worried about getting one.
Of course, and I think if kids at a younger age start understanding mental health issues, and just to know to identify the simple triggers and symptoms, they will know when they have anxiety one day or they have depression. We have seen a lot of people go to the hospital thinking they have a blood clot or something is happening, and it just turns out to be a bad anxiety attack.
So that's very common.
A bit of awareness can do a lot.
Like one of the most common things you would see, and we get referrals, is the amount of people that go to cardiologists thinking they have a heart problem. It's because they get heart palpitations.
That's right.
It's because they're anxious or they have a panic attack.
Overventilating, thinking they can't breathe.
And they do like a scan on them, and they do a heart reading, and then the cardiologist would refer them to us saying, well, your heart is perfect, it's fine, it's just you're anxious.
You're anxious, exactly. Well, doctor, thank you for all the information, but before we end this evening, what are some tips of how we can look after our mental health, especially with our busy lifestyles now?
So I think some lifestyle changes is important. I think one of the biggest things that people underestimate is the importance of sleep. Sleep plays a huge part of your mental health. That recovery point of sleeping and waking up is a huge difference of how much you can take in a day in terms of stress and anxiety, and even potentially triggering if you are genetically predisposed to having a mental health condition. So sleep is important. Exercise is by far one of the exercise is one of the things we tell our patients by default. You do therapy, medication, and exercise. Exercise is like the third unwritten rule of treatments. So exercise is important. You don't have to do it daily. You don't have to do hours and hours. 20 minutes every second day is more than enough. Even going for a walk. But also what's important is talking. As a people, we don't talk about our emotions.
That's right.
Especially in this region, we're always hidden from our emotions and pretend, oh, I'm okay, and it's okay.
Fine.
And it's fine. And the statement you said that hurt me, it's okay, it didn't really hurt me. I'm stronger than this, I don't want them. It's okay to say it. Sit down, explain to the person how you felt.
I have an issue with this.
Yeah, and it's okay to let people know how you feel. And the more comfortable you are about talking about these things, the more your mental health builds resilience, and therefore it's not easily broken or easily shook by anything that happened. Of course, and then overall the last thing is, I would say, maintaining your eating habits. You know, research has shown if you follow a Mediterranean diet, such as having fish and vegetables and these at high quantities rather than having the fast foods and meats all of them. It causes you to have a more stable mental health, and research has supported that a Mediterranean diet has supported a stable mental health. So include that into your day. Make sure there's fruits, make sure there's vegetables, make sure that you're not just eating things that make you feel good or taste good. Make sure you eat things that are helpful to your system.
Exactly.
So that sleep, exercise, and talking, I think these are a very easy way for you to kind of monitor yourself and make sure that you're protecting your mental health.
Of course. Thank you so much, Doctor. It was my pleasure interviewing you this evening, and I think the information you gave us was really helpful.
Thank you. The pleasure was mine, Rita. Thank you.
Thank you. Dear viewers, we had with us Dr. Abdullah Habib, Doctor of Psychiatry and Director of Clinical Neuropsychology. And up next is a report from the Ministry of Interior. Stay tuned for that.